Alright, so my name is Connor Fairfax. I'm going to be your nurse today. Um, what we're going to do, you're here for a regular checkup, but we normally go through these questions. Is it alright if I talk to you about your alcohol, tobacco, illicit drug use? Is that fine?
Yeah, sure.
Yeah, that's fine. Do you use alcohol, illegal drugs, or tobacco products?
I don't do drugs, like illegal drugs. I drink, when people drink socially. Smoking, yeah. Yeah, I smoke.
You smoke? Do
Yeah.
you mind if I ask you some questions about your smoking? Is that alright?
I mean, if that's what you guys do, that's fine.
Okay. So let's see. How much do you smoke typically, I guess, per day?
Probably like 2 packs.
2 packs a day?
Yeah.
That's pretty typical.
Yeah, pretty typical.
Pretty typical. All right. How long have you been smoking then?
Since I was 14.
14 years old.
Yep.
And so you did that. Okay. Since then, you've been smoking the entire time. No breaks.
No breaks.
No breaks. Okay. Do you have any health issues related to this? Have you noticed anything since you started smoking, health related, or anything a doctor's told you, anything like that?
I mean, I don't know if this is related to my smoking, but about I think 2 years ago, I was diagnosed with asthma.
Okay.
And I've been having some shortness of breath, and I feel like I'm always coughing.
And I mean, do you think that's related to your tobacco use, or do you think that's more just kind of coincidence?
I don't know. It could be just because I'm getting older, and my dad had some stuff, so I don't know.
All right. Do you have a family history related to tobacco use? Your mom, your dad, anything like that? Siblings?
My mom doesn't smoke, no, but my dad, he did smoke. He passed away from lung cancer a couple years back.
Okay. Yeah. So honestly, I'm a little bit concerned about your tobacco usage. You mentioned that you have asthma, some shortness of breath, a chronic cough, which are all kind of symptoms of using tobacco products. Mentioning that your father passed away from lung cancer, which was most likely, I'm not going to say it was, but most likely due to his smoking as well. And so I'm kind of concerned with that a little bit. Do you mind if we continue talking about it and I kind of offer you some advice on the subject, or?
I mean, that's not really why I'm here, but if you want to, I guess that's fine.
I think it'd be extremely beneficial if we kind of went down that path. But I would say the thing first and foremost is that we would really appreciate or really like if you could start to cut down your tobacco usage. Obviously, I'm not sure if you're quite ready. In your opinion, do you think you're ready to start cutting back or stopping tobacco altogether?
I mean, I've never thought about that before,
Yeah.
but probably not.
Probably
No.
not. All right. Well, what I have right here is actually a readiness ruler. So if you mind pointing at me right now where you think you could be to cut down on your tobacco usage and possibly stop using tobacco.
Is this like not ready?
Yeah, 0. So it means 0 means you're not ready at all, not at all, and 10 means you would stop right now, this second. So it's just where you think you'd be.
Probably like a 1, maybe a 2.
1 or a 2, somewhere in there.
Yeah.
All right. Well, you didn't choose 0, so obviously we have somewhere to start with that. What makes you a 1 or a 2 and not a 0?
I mean, if you would have asked me this about 5 minutes ago, I probably would have been a 0. But with saying that like asthma and stuff is related to this, that made me the 1 or 2 because these health problems and the cough is getting annoying.
Okay. And why do you think that you're not like a 9 or a 10 with this?
I mean, smoking's just my thing. That's what I do, and I don't want to quit it. I like it.
I gotcha. So one thing I want you to start talking about a little bit here. What are some things that keep you coming back to tobacco products, like that kind of thing?
It helps relax me, and I like it. I like the feeling. I like the taste, but for the most part, it's the relaxing. I mean, I'm sure I've had depression. Like I was inpatient even, and suicidal, and smoking's that thing that it just helps me calm down. And
calms you down, soothes,
yeah.
that kind of thing, relaxes. See, I understand. So with that, do you think there's any other activities, that kind of thing that you could do with that to kind of help you to relax, similar to the effects of tobacco with the soothing, the relaxing?
I don't know. I don't really do much. So,
don't do much, nothing like that.
Yeah.
All right. Well, we're gonna go the opposite now. Do you really? What reasons do you have to stop using tobacco? Like, give me some positive reasons to quit or cut down your tobacco use.
Definitely probably for my health. The coughing, the asthma. I don't know if that's reversible, but
Right.
it's frustrating. And then also I have a niece who I'm not allowed to see often because I'm not allowed to smoke around her, according to my brother. So I guess the secondhand smoke is why he doesn't. But I don't know. So that's a big thing. I can hang out with my niece more. Family's a big thing to me.
Okay. And so your family being a big thing with your niece, is that really one of the main reasons you would say that you want to start cutting down on your tobacco use?
Yeah, I mean it sucks not being able to see her, you
Mm-hmm.
know, because I can't go an hour without a cigarette. So that's only an hour I get to hang out with her.
So what do you think are some like motivation? You obviously you mentioned your niece. Is there any other things that would motivate you, in your opinion, to kind of cut down your tobacco use? Your health, you mentioned your
Yeah,
health, that kind of
the
thing.
health. Maybe also like people always say my clothes smell like cigarettes, but I don't notice it. But that
Gotcha.
could be it. My teeth would be whiter.
So what are some steps in your opinion right now that you could take to cut down on your tobacco use?
Um, I don't know. Maybe like talk to my support group about it. I go to a support
You
group
go
for
to
my
support group.
depression.
Okay.
Yeah, I kind of lead it sometimes.
Okay. Yeah. So there's a couple different steps that you could take to do this. I wanted to see in your opinion what you thought. Obviously, mentioning a support group, there's tobacco support groups, similar like alcoholic support groups, depression support groups, which you're already in. You mentioned that you were in charge of leading this group, so maybe
Mhm.
you could incorporate some tobacco type things into your group, and maybe some motivational types things with that, with tobacco cutting down with that. Is there anybody else in your group you think that would be interested in something like that?
I don't know. I mean, honestly, almost everyone in the group smokes, so I'm
Okay.
sure we could. Maybe there's someone that's thought about it before.
Yeah. Well, you could bring that up at your next meeting if that's all right with you. What about have you ever thought about using like a nicotine gum type thing?
Yeah, I mean, I think that would work because it's. I like having something like
The oral
yeah, the
fixation.
oral fixation, something to focus
Okay.
on. So
All right. And what about like a nicotine patch?
probably not the patch because like that's not visible, so like you don't have that constant reminder.
Okay. All right. So with those, let's kind of go back on that. So we think we could possibly do like a support group type thing. Maybe if you can't incorporate it into your group, going and attending a support group, something like that. We could try the nicotine gum, that kind of thing. Where do you think you're at and kind of trying to take steps towards doing this? So if I give you the readiness ruler again, where would you say you are now to cut down?
Maybe like a 6 or a
A
7.
6 or a 7?
Yeah.
Okay. And do you think that's to kind of cut down or to stop smoking altogether?
Probably to cut down. I
Cut
just
down.
think it's not realistic for me to stop smoking. You know, like I've just been doing it for so long.
Okay. Well, what I would like to do is kind of make some goals for us for our next time that we meet together. Do you have like one, two, three maybe goals that you could kind of think of with how many cigarettes you want to smoke to
Yeah.
cut down, like that kind of thing? Some goals.
Yeah, probably try to just stick to a pack a
Pack
day.
just to start.
Yeah, because
Okay.
that's still a big cut down.
Right. For you, exactly. You have to start somewhere. So,
Yeah.
how soon do you think you would be ready to kind of get that going with cutting down?
I don't know. Maybe I don't know. I don't know how quick that gum will work and
Right.
stuff to help me get rid of
All
the
right. Well, I'm,
urge.
well, I'm glad we had this talk today. I'm glad that we kind of got some goals set. You really seem kind of focused on your niece, really wanting to hang out with her, and so that's all very good. Do you mind if we set up another date to kind of come back and assess your goals and see where you're at and trying to stop smoking?
Yeah, we can do that.
Yeah.
Mhm.
All right. Well, thank you very much for your time. I really appreciate it.
Yeah.